Thank you for joining us today for this webinar on how to plan for and conduct a walkability audit. My name is Catherine Hebert, and it is my privilege to be the project manager for the Charlotte Plan4Health initiative. Neighborhoods in Charlotte with the greatest risk for poor health outcomes, and is therefore the focus of our project. The vision for Plan4Health Charlotte increases physical activity opportunities and the number of people of all ages and abilities being physically active in Charlotte neighborhoods, most at risk for poor health outcomes. Our goals are to engage community members in order to paint a comprehensive picture of the barriers and opportunities to increasing physical activity in these neighborhoods. We also hope to make short and long-term recommendations to coalition members and neighborhood leaders for increasing physical activity, and to provide residents with a planning service based on a topic of interest. Finally, we hope to work with our partners to replicate this project in the Centralina region and throughout North Carolina. To accomplish this vision and our goals, we are taking a comprehensive approach, including 6 strategies. Today we will be focusing on the second strategy of walkability and bikeability audits. So what is walkability? Walkability is more than just whether or not there is a sidewalk, but looking at the entire pedestrian realm and making places great. When assessing walkability, we look at the golden triangle, or elements within the horizontal and vertical plane that add to the pedestrian realm. For example, in this commercial area, we would look for wide sidewalks and outdoor seating in the horizontal plane, and inviting entrances and windows on the vertical plane. The golden triangle principle can also be applied to a neighborhood setting. Once again, looking for wide sidewalks with a buffer in between walkers and traffic, and street trees and front porches to create a welcoming connection between the private realm of people's homes and the public realm of the streetscape. So now that we have a general idea of what walkability is, let's talk about developing a walkability audit and our experience conducting walkability audits in Charlotte. We were fortunate to have a lot of these groups already within our coalition, so pulling in their expertise is relatively easy. But if you do not have a coalition to work with, finding contact information for these groups and reaching out to them to help you with your project is a key first step. With your partners in place, you want to turn to selecting your route or routes to audit. If you are using the audit as an educational opportunity, you want to be sure to show participants both good and bad aspects of the streetscape. We worked with our Department of Transportation to identify some spots that had recently been improved next to areas that still needed improvements. Keep in mind that the length of the walk and other logistics, such as parking, when determining the route and your participants. Now for the fun part, developing the tool. We took the AARP Walk Audit Toolkit, which already had a lot of good questions and easy instructions, and tailored it to meet our needs using Microsoft Word and a screenshot of Google Earth. This is the title page for our audit of Clanton Road. Note we have included the route name, date of the audit, start and stop time, and participants. We've also created a map of the route to help orient participants and broken the route into segments for the audit. The second page includes general instructions and encourages participants to continue the conversation and reach out to those leading the audit. If you are breaking into smaller groups to do the audit, I suggest you include cell phone numbers as part of this information in case of emergency and to help connect the different participant groups. Here are 2 excerpts from the audit looking at characteristics of the intersection and the streetscape walking along a stretch of road. Be sure to remind participants that we are evaluating the streetscape for all users, including those who may walk slower than you or need assistant devices such as canes or a wheelchair. If there is a greenway connection on your route, be sure to highlight it as another transportation connection, especially for bikers and those who don't feel comfortable walking near traffic. This audit also looks at transit accessibility and the behaviors of drivers, pedestrians, and bicyclists. These elements also add to or detract from the use of the streetscape and feelings of safety. Your tool, it's time to recruit participants. Definitely take advantage of your networks and your partners' networks to get people out there walking with you. Other things to keep in mind is what day of the week and time you are going to do your audit, and are all user groups represented, and is the route going to be safe for all ages and abilities, or are there things you can do to make the audit more inclusive? Don't be surprised if you see things like this on your walk. Remember, you are auditing these routes for a reason. But also take time to capture what is good on the route and use these examples when making recommendations for improvement. So some lessons learned. Keep your expectation and the expectations of your partners and participants realistic. Don't decide you will do a 5-mile stretch or 50 audits if you have limited staff and time. Always have extra pens and take more pictures than you will probably use. Also be prepared for residents to ask you questions on what it is you are doing and how you plan on using this information. Here are some links to additional resources, including a YouTube video on walkability audits and AARP's tool. And my contact information and project website for our audit tool. Thanks for joining us today, and feel free to contact me if you have any questions.